Alzheimer's disease. This is the most common form of dementia, accounting for 60 to 80% of all cases worldwide. It begins quietly, usually with small lapses in short-term memory that are easy to dismiss as normal aging. Forgetting where the keys were left, repeating the same question, losing track of a conversation. But what is happening beneath the surface is far from ordinary. Abnormal proteins called amyloid plaques and tau tangles are building up in the brain, disrupting communication between nerve cells and eventually killing them. The damage typically starts in the hippocampus, the region responsible for forming new memories, and then slowly spreads to other areas that control language, reasoning, and behavior. Over time, a person with Alzheimer's may struggle to recognize familiar faces, lose the ability to carry out everyday tasks, and undergo significant personality changes. The progression is gradual but relentless, usually spanning 8 to 12 years from diagnosis. There is currently no cure, though medications can temporarily slow some symptoms in the early and middle stages.
Vascular dementia. This form is caused by reduced blood flow to the brain, usually as a result of a stroke or a series of smaller strokes that may go unnoticed. When blood flow is blocked or severely limited, brain cells are deprived of oxygen and nutrients, and they begin to die. The symptoms depend heavily on which part of the brain is affected and how much damage has occurred. Some people experience sudden cognitive decline immediately after a major stroke, while others deteriorate in a stepwise pattern, with each small vascular event causing another noticeable drop. Problems with planning, organizing, and decision-making tend to be more prominent early on than memory loss, which is one way vascular dementia can be distinguished from Alzheimer's. Risk factors overlap significantly with those for heart disease and stroke, including high blood pressure, high cholesterol, diabetes, and smoking. Managing these conditions can slow or even prevent further damage, making vascular dementia one of the more preventable forms.
Lewy body dementia. This form is caused by abnormal protein deposits called Lewy bodies that build up inside nerve cells throughout the brain. These deposits disrupt the brain's normal functioning and lead to a distinctive set of symptoms that can be confusing to diagnose. People with Lewy body dementia often experience vivid visual hallucinations early in the disease, sometimes seeing people or animals that are not there. They may also have significant fluctuations in alertness and attention, seeming sharp and engaged one moment, then confused and drowsy the next. Movement problems, similar to Parkinson's disease, are also common, including stiffness, slow movement, and tremors. Sleep disturbances can be severe, with people physically acting out their dreams in a condition called REM sleep behavior disorder, sometimes years before other symptoms appear. Lewy body dementia is the second most common form of progressive dementia after Alzheimer's, yet it remains widely underdiagnosed because its symptoms overlap with both Alzheimer's and Parkinson's. Frontotemporal dementia. This group of disorders results from damage to the frontal and temporal lobes of the brain, the areas responsible for personality, behavior, and language. What makes frontotemporal dementia stand apart from other forms is that it often strikes earlier, typically between the ages of 40 and 65, and memory may be relatively preserved in the beginning. Instead, the first signs are usually dramatic changes in behavior or language. A person who was once socially appropriate may begin acting impulsively, saying inappropriate things or losing interest in activities they previously enjoyed. Others may develop progressive difficulty finding words, understanding speech, or constructing sentences. There are several subtypes, each emphasizing different symptoms. The behavioral variant is the most common and can be particularly difficult for families because the person may seem physically healthy but fundamentally changed in personality. Frontotemporal dementia progresses steadily, and there is no cure, though speech therapy and behavioral strategies can help manage some symptoms.
Mixed dementia. This term refers to a condition where two or more types of dementia exist simultaneously in the same brain. The most common combination is Alzheimer's disease, occurring alongside vascular dementia, but other pairings, including Alzheimer's with Lewy body dementia, have also been documented. Mixed dementia is more common than many people realize, and autopsy studies have shown that a significant number of people diagnosed with one type of dementia actually had evidence of multiple types. The symptoms can vary widely depending on which types are involved and which brain regions are affected. Diagnosing mixed dementia during a person's lifetime is challenging because the symptoms of one type can mask or overlap with the other. Understanding that dementia can have multiple simultaneous causes is important because it influences treatment decisions and helps explain why some patients progress differently than expected.
Parkinson's disease dementia. This develops in some people who have been living with Parkinson's disease for many years. Parkinson's itself is primarily known as a movement disorder, causing tremors, rigidity, and slowness of movement. But as the disease progresses, cognitive changes can emerge, eventually reaching a level that qualifies as dementia. The thinking problems tend to involve attention, executive function, and visual spatial abilities, rather than memory in the early stages. Hallucinations, depression, and sleep disturbances are also common. The underlying cause is related to the same Lewy body proteins seen in Lewy body dementia, which is why the two conditions are closely linked. The key difference lies in timing. If cognitive symptoms appear before or within a year of motor symptoms, the diagnosis is typically Lewy body dementia. If the movement problems came first, by more than a year, it is classified as Parkinson's disease dementia. This distinction matters for treatment, though the two conditions share many features and challenges.
Huntington's disease dementia. This is the cognitive decline that accompanies Huntington's disease, a genetic disorder caused by a single faulty gene inherited from a parent. Every child of a person with Huntington's has a 50% chance of inheriting the mutation. The disease typically appears between the ages of 30 and 50 and causes a progressive breakdown of nerve cells in the brain. The early cognitive symptoms often include difficulty organizing thoughts, trouble with multitasking, and impaired judgment. As the disease advances, the dementia becomes more severe and is accompanied by involuntary movements called chorea, as well as psychiatric symptoms like depression and irritability. What makes Huntington's particularly devastating is that it affects movement, cognition, and emotional regulation simultaneously. And it is fatal, usually within 15 to 20 years of symptom onset. Genetic testing can determine whether someone carries the mutation, but the decision to be tested is deeply personal because there is currently no way to prevent or cure the disease.
Creutzfeldt-Jakob disease. This is an extremely rare and rapidly fatal form of dementia caused by misfolded proteins called prions. Unlike other forms of dementia that progress over years, Creutzfeldt-Jakob disease moves with alarming speed. A person may go from the first subtle symptoms to severe dementia within a matter of months. Early signs often include memory problems, personality changes, impaired coordination, and visual disturbances. As the disease progresses, mental deterioration becomes rapid and severe, often accompanied by involuntary muscle jerks called myoclonus. Most people with the sporadic form, which accounts for roughly 85% of cases, die within 1 year of symptom onset. The disease can occur spontaneously, be inherited through a genetic mutation, or in very rare cases, be acquired through exposure to infected brain or nervous system tissue. There is no treatment and no cure. Creutzfeldt-Jakob disease remains one of the most feared neurological conditions because of its speed and its absolute lethality.
Wernicke-Korsakoff syndrome. This is a form of dementia caused by a severe deficiency of thiamine, also known as vitamin B1. It is most commonly associated with chronic alcohol abuse, though it can also result from malnutrition, prolonged vomiting, eating disorders, or other conditions that prevent the body from absorbing thiamine properly. The syndrome actually consists of 2 stages. Wernicke's encephalopathy comes first and is an acute medical emergency characterized by confusion, difficulty with coordination, and abnormal eye movements. if treated quickly with high-dose thiamine, some of the damage can be reversed. If not treated, it can progress to Korsakoff syndrome, a chronic condition marked by severe memory impairment, particularly the inability to form new memories. People with Korsakoffs may also confabulate, meaning they fill in gaps in their memory with fabricated stories without realizing they are doing so. Unlike most other forms of dementia, Wernicke-Korsakoff syndrome is largely preventable through adequate nutrition and responsible alcohol consumption.
Normal pressure hydrocephalus. This is one of the few forms of dementia that can potentially be reversed with treatment. It occurs when cerebrospinal fluid, the liquid that normally cushions and protects the brain, accumulates in the brain's ventricles and puts pressure on surrounding tissue. The classic triad of symptoms includes difficulty walking, urinary incontinence, and cognitive decline, often appearing in that order. The gait disturbance is particularly distinctive, with a wide-based, shuffling walk that looks as though the person's feet are glued to the floor. Normal pressure hydrocephalus most commonly affects people over 60 and is often misdiagnosed as Alzheimer's or Parkinson's because the symptoms overlap. The key difference is that a surgical procedure to drain the excess fluid through a shunt can significantly improve or even fully reverse the symptoms in some patients. This makes accurate diagnosis critically important because without it, a treatable condition may be left to worsen unnecessarily.
Posterior cortical atrophy. This is a rare form of dementia that primarily affects the back of the brain, the area responsible for processing visual information. Unlike most other dementias, the earliest symptom is not memory loss, but rather difficulty with vision and spatial awareness. A person may struggle to judge distances, have trouble reading, find it hard to navigate familiar environments, or have difficulty recognizing objects, despite having perfectly healthy eyes. Because the visual problems come first, many people initially visit an eye doctor before the true nature of the condition is identified. Posterior cortical atrophy is most commonly caused by the same amyloid and tau pathology found in Alzheimer's disease, which is why it is sometimes called the visual variant of Alzheimer's. It tends to appear earlier than typical Alzheimer's, often in the mid-50s or early 60s. Memory and language are usually preserved in the early stages, which can make the diagnosis even more confusing. Over time, the degeneration spreads, and broader cognitive decline follows.
If you found this video helpful, make sure to hit that subscribe button and turn on notifications so you never miss a new upload.